Well, there's clearly a lot of excitement everywhere about the vaccine news. We do have to take a quick reality check. That's because America is seeing its worst coronavirus surge yet. But experts say increased, faster testing could stem outbreaks before they explode. Here to discuss the state of U.S. testing is a Bloomberg healthcare reporter, Emma Court in New York. Emma, thanks for joining us on Quick Take today. We're over 6 months into the pandemic. Is the U.S. testing enough people right now?
Thanks so much for having me. And, it's a good question. It seems to be the perennial question of this pandemic. And the answer is it depends. And if you look in particular across different states and the test positivity rates in different states, you'll see that in most U.S. states, the test positivity rates are actually higher than what the World Health Organization recommends. Basically in a couple of states, half of tests return positive, half of tests done return positive. That's a pretty staggering number. And so, when we have so many people getting tested, coming back with positive results, it suggests we're not catching everyone who has the virus. And what's concerning about that is if you look at these record numbers, these record infections that are being confirmed every day in the U.S., it means that those numbers may only be part of the picture. It's something we've struggled with throughout the pandemic. Are we getting a clear enough view on how this virus is spreading throughout the country? And the answer right now seems to be no, we're not.
So what is our testing strategy here? Because the CDC has sort of gone back and forth about who should be tested and when they should be tested. What do experts say who you speak with?
Yeah, so, obviously the big issue with this virus is we know that people can be silent spreaders of it. So we know that people who feel sick, who are staying home are not, accounting for all of the viral spread. And so that's been a persistent problem. CDC, did have guidance a little earlier this fall saying, maybe you don't need to test people who don't have symptoms. They changed course on that. I think the consensus right now from public health experts is we should be testing as much as possible. The issue is that even though testing capacity in the U.S. has significantly expanded since those early days when almost nobody could get a test, we're still having an issue of people are having problems getting access to tests. Here in New York, where I'm based, for instance, people are waiting for hours online. This is something that I think health experts hoped would be better by this point in the pandemic. And with a vaccine still months away, this is the reality of our situation here.
I think the big question I have is why, Emma? I mean, I'll remember back to months ago in March when President Trump stood outside the White House and talked about how everybody who wants a test could get a test. And here we are so many months later. And that's not the case unless you're willing to wait in line for hours at a time. Why has this had so much trouble in the U.S.?
There are a variety of reasons. I think there's been a big criticism of the Trump administration's strategy on testing, which is, public health experts say the administration didn't take a nationally focused enough approach on a variety of things, including testing. And that's resulted in labs not having enough supplies, not a lot of coordination between different states, even on things like testing policy, which, everyone needs to have. So that's been a big point of criticism. I would venture a couple of other important factors here. One is just the sheer size of the United States and the real underfunding of public health infrastructure over the years. We've seen President-elect Joe Biden talk about, real nationally focused testing strategy, but, his administration may also benefit from some of the investments the Trump administration has made in trying to expand diagnostic makers, manufacturing capacity. Those investments are going to take some time to pan out, and hopefully they'll start panning out a little bit more early next year. And so you may see the Biden administration actually, benefit pretty early on from some of these investments because they just do take, when you're setting up new manufacturing lines, that does take quite a lot of time to do.
Well, Emma, very briefly, what has the Biden administration, or I should say the President-elect's administration, what has the task force proposed at this point when it comes to testing, and what could we expect to see come January from President-elect Biden?
Yeah, we've basically heard the Biden, President-elect Biden talking about all of the things public health experts have been asking for throughout this pandemic, right? He's talking about, a nationally focused strategy, playing a more federally, prominent role in some of the issues around, testing supplies, other kinds of medical supplies. really focusing on rapid testing and getting more access to not just the testing technologies that are already available, but next generation technologies that could make it possible to get a test at home, for instance. And these are things that people have been talking about for a long time, also protecting vulnerable populations using testing. And some of these things have been pushes from the Trump administration as well. But I think that real national focus, it'll remain to be seen how that stronger federal role, if that does pan out, will work to resolve some of these issues. I think people are optimistic that it will, but, it's easy to say you'll do that strong federal role. And, it's something we'll need to see how it pans out.
Bloomberg's Emma Court in New York, thanks so much for joining us on Quick Take today. We appreciate it.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.